The community has lacked a formal transitional housing option for many, many years. Some would call it a shelter, some would call it transitional housing, but I think the bottom line is that with the addition of the Woodstock Avenue Bridge Housing Project, we'll have a significantly greater level of flexibility to meet the needs of families who are transitioning out of homelessness.
I work as a peer advocate counselor at VCIL. I've been working there for almost 8 years, and I work with peers who have a wide variety of disabilities. Sadly, we have a lot of homeless people that we work with, and finding them housing sometimes is a challenge.
Housing was one of the top 4 community health needs that we identified in our community health needs assessment we conducted a couple of years ago. And housing is critical to people's health and well-being.
Managing a chronic illness is a challenging thing, and engaging patients in the management of their own chronic illness is really important. Very hard to do that if there's not a stable home environment to work out of. And patients who have that to look forward to from when leaving the hospital are much more engaged in managing their own illness.
It's one thing to get people into housing, it's another thing to provide them with the supports to ensure success.
A lot of what's going on in healthcare and a lot of things that are contributing to the cost of healthcare have to do with not your medical situation or your genetic background, but due to social determinants of health, of which adequate housing is one of those. So for example, in Vermont in the wintertime, a lot of times we see people show up at the emergency department not because of medical needs, just because they need to get in and out of the cold.
In the emergency department, we struggle many times to get patients who don't have emergency medical needs or emergency surgical needs, for example, to a safe place. And so that means in many cases they have to remain in the emergency department, which is a very busy and chaotic environment. And having the ability to get folks to a safe, secure, and reliable environment really begins the healing process in ways that are delayed otherwise.
It's hard to be healthy if you're just trying to find a place to sleep or to live. You know, how are you going to get food for yourself or even afford food if you're just trying to survive on the street?
So the truly exciting aspect of this project has been the willingness of so many organizations to come together to make it a success. Without that support, we clearly would not be where we are.
I've seen very few communities in my lifetime where people really rally around each other. Whenever there's a cause, whenever there is someone in need, you see people in Rutland really come together.
I would say it's very important to support the Housing for Health campaign, because it would help a lot of people get out of homelessness and into safe, affordable, accessible housing and improve a lot of lives.
And your dollars will go to an immediate project that's already been approved and is being developed that will be up and running by the end of 2020.
We are extraordinarily grateful for anyone who is willing to support the campaign at any level, because it's a community effort and it's going to take a lot of people in order to achieve the goal. So I can tell you with certainty that it'll be a good investment in the community, and the Rutland Housing Authority, along with our project partners, will make you proud.
On behalf of Rutland Regional Medical Center, the Rutland Housing Authority, and all of our community partners that are participating, a sincere thank you. Without your help and support, this important community project might not be possible. Thank you very much.